So we're going to go back to her issue, or the thing that we identified as a functional movement she couldn't do. So what we call a meaningful task or a functional task or a patient-specific functional movement. It doesn't matter as long as you're rechecking what they came in for or with something functional that they couldn't do. We're going to go back and retest that forward flexion. That looks good. Reversing a little bit. She's still got a nice long lordotic curve. We'd like to fix that a little bit. Come back up. But you can see her weight shift. She's getting a lot more posterior weight shift, which is a good sign she wasn't getting that as well. So we'll do that one more time. Yeah, she's able to commit to the motion. We can actually see her sacrum counter-nutating as she goes down. So perfect. Come back up. And then she was also saying that when she stood up, she felt like her feet felt different. So like she was standing on her feet similarly, more support. Still had a little bit of end pain, end range pain, tightness, pain.
A little bit of tightness and pain.
And that's mainly kind of issue of tuberosity now on the right, which incidentally is right around the same spot where the sacrotuberous ligament will blend into the glutes, and the fibers will come down and blend in there. So we can adjust that as well. So now let's look at the pelvic girdle motion, reassess now that we hopefully did a good treatment. Remember, proof of the pudding is in the eating. So let's look at PSIS height. I think we're pretty money on that. Maybe a millimeter, not much. I can't even measure that little. Not 100% sure, but it looks pretty good. Iliac crest looks good. Go ahead and turn around for me, please. ASIS, just from a visual inspection, looks good. Okay, come back around. If we look at sacral sulcus, still looks a little up. If we just look at sacral sulcus, might have a little bit of sacral work to do, but much better. I'm fairly happy with that so far. Motion's better, her functional task is better. Let's see if the individual motions are better. Right knee towards your chest. Perfect. Left knee. Ooh, nice. Right knee. Still not coming, now you're not coming back as well on the right. I mean, it's still coming down, but I don't feel, she's still got that in-flare going on. That's what I'm feeling. And then you can watch her shake too as she comes down. So go ahead and come up. Okay, and then back down. You don't see it as much as maybe you saw in the first ones where her muscles are trying to figure out how to hold her there. Side bend to the right. Good. Side bend to the left. Okay, now I want you to forward flex. That's good, they both come back equally. And then extend. And that's nice because they both disappear. So, much better. Let's try to look at the flare. Still going forward, not coming back. Okay, perfect. So, we're going to correct this flare.